When I heard the diagnosis of cancer a year ago, my first reaction was denial. I kept thinking it was a mistake and that it couldn't be true. I'm so healthy and I'm a good person. How can this happen to me? I'm Judy San and I'm a breast cancer survivor. I have had a great career and I have been very involved with charity work for the past 30 years. I always try to give people a helping hand. I just never imagined that one day I would be the one needing support. So once I had a treatment plan, I go over my initial fear and denial. I decided to focus on getting better. And I said to myself, okay, let's deal with it. Just because I have cancer doesn't mean I'm going to die from cancer. For the past year, I have gone through the challenging journey from diagnosis to 12 chemo sessions, then surgery, and then 16 radiation sessions. I'm happy to tell you that I'm now cancer-free. After the diagnosis, I kept telling myself, I can overcome this, and I kept attending my weekly Mandarin and my painting classes. Being productive and active with my favorite activities helped me feel a sense of control rather than being totally besieged by this illness.
Judy is a person who always puts others' needs before her own. She's always there to lend a helping hand to her family, her friends, or even total strangers, regardless of how big or small their problems may be. Upon the cancer diagnosis, my first task was to convince her that she had to let go of it and start letting others take care of her. Even with cancer, it was a struggle for her. My other role was also to remind her how beautiful she is, especially when she started losing her hair and having marks and scars all over her body from chemotherapy, surgeries, blood tests, radiation, and on and on. However, the bulk of the work was done by Judy, who never wavered from her commitment to tackle this challenge regardless of outcome, just like she has always done in both her professional and community work.
If you are a patient, I encourage you to keep a logbook. Always prepare questions for the doctor before your appointment, and keep detailed notes you can refer to. Cancer is something no one wants to face, but when it happens, you really have no other choice but to deal with it. You can't change a diagnosis, but you can fight the disease. During treatment sessions, it is also nice to interact with the other patients in the treatment room. Sharing experiences provide positive support for both you and them. Because I avoided anxiety, I could always sleep well, and that helped keep my immune system strong. Of course, just being positive is not going to cure your cancer. But if you focus on the positive things around you, you'll be having a very meaningful and happy life. I'm thankful to be alive. And this day, I'm walking around with a grin in my face and a warm glow in my heart. My friends have been telling me that I'm brave and strong. But for me, I'm just a survivor.